More than 1,000 less privileged persons in Maiduguri have benefited from food, seedlings and cash assistance courtesy of the Wali of Borno. The humanitarian assistance is aimed at giving them a sense of belonging. TVC News' Jesse Tafida reports.
6 different locations within Maiduguri and Jere Local Council benefited from the humanitarian gesture, including the State Specialist Hospital, Kamburi Kura, Kamburi Ghana, and Fatima Ali Sharif Orphanage. Other State Specialist Hospital, patients at the pediatric ward benefited from cash assistance to enable them buy drugs and other medical items.
We need to identify ourselves as colleagues in humanity, our human colleagues before any other thing. We should always try and reach out to the downtrodden, those truly in need, those that cannot reach out. I often say, even if you don't have much, but if you have the privilege to reach out to someone and even ask, it's even a privilege. So we'll keep doing that for as long as we live and whatever means we have.
Medical Director of the hospital and beneficiaries lauded the monarch for the gesture.
We are happy to have people like you in our midst that have been doing this. Is not the first time and this is not the second. So we are very happy for the system. Allah reward.
She says, I never expected this today. My son has been sick for 5 days now. This support would go a long way in settling our medical bills. I am very grateful by this gesture. I'm delighted. I pray God to bless Wali for doing this. Food and cash assistance was also distributed to the blind in Maiduguri as well as to the Fatima Ali Sharif Orphanage. The Wali of Borno also presented 500 different types of seedlings to be used by the less privileged as economic trees. The management of the State Specialist Hospital appreciate this gesture and are calling on other well-to-do individuals to come to the aid of the less privileged in the society so as to put a smile on their faces. Jesse Tafida, TVC News, Maiduguri.
Are you aware that each year recyclables save more than 700 million tons in global carbon emissions? But by 2030, this figure is expected to have increased to 1 billion tons. With that in mind, environmental advocates are urging for better ways of recycling, which will save more lives and the environment. Kemi Balogo reports.
It is Global Recycling Day, a day set aside to encourage people to think again about what is thrown away. This year is shifting focus to celebrate the recycling fraternity, those who put themselves on the front line to collect waste and recycle them during the multiple lockdowns.
To support improvement.
This school in the heart of the capital city is doing its own part to ensure that waste is used for the good of the students and not left to be harmful to the environment through the construction of this toilet.
We need to keep the world clean and the environment clean so that we won't have like issues with the environment.
Encourage, and I'll also put waste bins in every corner of my house so that it can be easier if you want to recycle anything rather than throwing it on the floor, and also be hygienic.
When you get these waste and you're able to segregate them properly, you'll be able to know which one you can recycle and they will be of use. Even in the school here, that is what we do.
Global Recycling Day was created to help recognize and celebrate the importance recycling plays in preserving the primary resources of the planet. Environmental advocates like Dorothy believe that recycling is one way to save the planet and secure its future.
Most of the waste we generate in our offices, in our homes, in our schools are majorly recyclable waste. I'm talking of paper, I'm talking of plastic and metal. So what we do now, instead of evacuating this waste to the dump sites, we train cleaners for free to segregate this waste using the color-coded bin, and when they segregate it, we evacuate it to a recycling company free of charge.
The day strives to urge world leaders that recycling must be a global issue and encourage people to think resourcefully and not waste. Kemi Balogun, TVC News, Abuja.
Nigerian Medical Association (FCT) is proposing an extension period for the disengagement of the public-private partnership arrangement between the Federal Capital Territory Administration and the current management of the Garki General Hospital, Abuja. They believe this will give room for a more effective, smoother and more humane transition for both the patients and more than 900 medical personnel that could be affected. Kemi Balogun has more.
Since the 1st of March this year, reactions have continued to trail the notice served to the management of the Garki General Hospital by the Federal Capital Territory Administration to vacate and hand over the facility. An agreement signed between the duo in 2007 has now elapsed after 15 years, but the ripple effect caused by the suddenness of this disengagement order has been termed as ill-timed. Today, the Medical Association, who are at the verge of losing hundreds of jobs, are lending their voice to this issue, calling for a reconsideration to the time frame given so that no one is left behind.
If there's a debt to be paid and is the reason for the termination notice, I'm sure they can sit down and come to some form of agreement. Because if you rent somebody's house, you're supposed to pay rent. And so, but my worry now is the tenants who have been working assiduously in the last 15 years in that facility, who have been holding forth when all the public hospitals have been on strike. And we all know that when all the public hospitals are on strike in FCT, Garki Hospital still works, still functions. And all of a sudden you're asking them to pack their bags and go home within a short period.
I don't think 1 month is reasonable notice for a facility of that nature. And that even if it is also part of the agreement, looking at the facilities, we feel that using self-help will not be advisable. Because what happens if at the end of 1 month they are unable to evacuate?
The group also wants the federal government and the Nigerian National Petroleum Corporation to look into the present fuel crisis happening in the country in order to lessen the burden on doctors.
The situation has severely affected the practice of medicine. Health workers are now finding it increasingly difficult to get to their places of work to discharge their duties, not to mention the adverse effects on productivity.
Lawmakers on Thursday had resolved to ask the FCTA to stay action on the termination of the concession agreement, pending the intervention of the committees on privatization, commercialization, and health institutions on the matter. More than 100 doctors and thousands of patients could be affected if the FCTA goes through with the vacation order. Kemi Balogun, TVC News, Abuja.